AMCA Pharmacy Technician Questions, 197 questions with explained answers. Question 1. Most specialists are paid by managed care organizations using which of the following methods? Option A, fee-for-service. Option B, coinsurance. Option C, copayment. Option D, capitation. The correct answer is option A, fee-for-service. Explanation. Fee-for-service reimburses the specialist for individual services performed rather than paying a fixed amount per enrolled patient. Question 2. When medical assistants are able to adapt to various situations, they are considered to be: Option A, courteous. Option B, flexible. Option C, dependable. Option D, loyal. The correct answer is option B, flexible. Explanation. Flexibility is the ability to adjust behavior or plans when circumstances change, which is important in a busy medical office. Question 3. A female patient came into the emergency room with her husband. She was suffering from severe shortness of breath. She appeared to be unable to take in sufficient oxygen. What is the color of the skin and nail beds? Option A, brownish. Option B, greenish. Option C, reddish. Option D, bluish. The correct answer is option D, bluish. Explanation. Bluish discoloration of the skin or nail beds can indicate cyanosis, which occurs when the blood contains an increased amount of deoxygenated hemoglobin. Question 4. You performing a venipuncture procedure on a patient. The needle appears to be inside the vein yet no blood ID flowing into the tube. What should you do? Option A, pull back on the needle. Option B, terminate the procedure. Option C, slightly rotate the needle. Option D, switch the tubes. The correct answer is option D, switch the tubes. Explanation. If the needle appears to be in the vein but no blood enters the tube, a defective tube with lost vacuum is one possible cause, so changing the tube is an appropriate troubleshooting step. Question 5. How many electrodes are used as part of a 12-lead electrocardiogram? Option A, 10. Option B, 6. Option C, 12. Option D, 8. The correct answer is option A, 10. Explanation. A standard 12-lead electrocardiogram uses 10 electrodes to generate 12 electrical views of the heart. Question 6. Collection devices used in skin punctures are called: Option A, capillary tubes. Option B, butterfly sets. Option C, blood culture collection systems. Option D, 25-gauge needles. The correct answer is option A, capillary tubes. Explanation. Capillary tubes are designed to collect small blood samples obtained by skin puncture, such as from a finger or heel. Question 7. The smallest structural unit of the nervous system is the: Option A, spinal cord. Option B, neurofibrils. Option C, neuron. Option D, supine. The correct answer is option C, neuron. Explanation. The neuron is the basic structural and functional cell of the nervous system because it receives, processes, and transmits nerve signals. Question 8. What is the best location to check the pulse of an adult who is unconscious and not breathing? Option A, at the carotid artery of the neck. Option B, on the chest, directly over the heart. Option C, at the radial artery of the wrist. Option D, at the brachial artery of the arm. The correct answer is option A, at the carotid artery of the neck. Explanation. The carotid artery is a central pulse site that is commonly checked in an unresponsive adult because it can remain palpable when peripheral pulses are weak. Question 9. Which of the following types of filing systems requires a cross-reference files? Option A, alphabetic. Option B, subject. Option C, geographic. Option D, numeric. The correct answer is option D, numeric. Explanation. Numeric filing systems require an alphabetical cross-reference or index so staff can locate the patient's assigned number from the patient's name. Question 10. A is a set amount that the patient may be required to pay the provider before they can receive benefits. Option A, coinsurance. Option B, deductible. Option C, copayment. Option D, fee schedule. The correct answer is option C, copayment. Explanation. A copayment is a fixed amount the patient pays for a covered service, usually at the time the service is received, according to the insurance plan. Question 11. One method to calculate heart rate from an electrocardiogram strip is to: Option A, count the small boxes between the R to R interval and divide by 1,500. Option B, count the number of small boxes in the R to R intervals and divide by 2. Option C, estimate by counting R peaks in 10-second strip and multiply by 10. Option D, count the number of QRS complexes in a 3-strip and multiply by 10. The correct answer is option A. Count the small boxes between the R to R interval and divide by 1500. Explanation. At a paper speed of 25 mm per second, dividing 1500 by the number of small boxes between consecutive R waves estimates the heart rate for a regular rhythm. Question 12. Two premature ventricular complexes in a row are called A and N of premature ventricular complexes. Option A, deuce. Option B, couplet. Option C, bijgeminie. Option D, double. The correct answer is option B, couplet. Explanation. Two premature ventricular complexes occurring consecutively are called a couplet. Question 13. What is the best sample for the determination of blood pH and blood gases? Option A, cerebrospinal fluid. Option B, arterial blood. Option C, venous blood. Option D, capillary blood. The correct answer is option B, arterial blood. Explanation. Arterial blood is preferred for blood gas testing because it best reflects oxygenation, ventilation, and acid-base status after gas exchange in the lungs. Question 14. Veterans with service-related disabilities are eligible for care under which of the following programs? Option A, TRICARE. Option B, VetServe. Option C, Civilian Health and Medical Program of the Department of Veterans Affairs. Option D, CHAMP Aid. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 15. Defamation through spoken statements is known as Option A, libel. Option B, sympathy. Option C, empathy. Option D, slander. The correct answer is option D, slander. Explanation. Slander is defamation communicated through spoken words, while libel generally refers to defamation in written or recorded form. Question 16. Which of the following tests is not a part of complete blood count? Option A, activated partial thromboplastin time. Option B, differential. Option C, hemoglobin. Option D, hematocrit. The correct answer is option A, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is a coagulation test, not a component of the complete blood count, which evaluates blood cells and related indices. Question 17. Which of the following is correct regarding contact transmissions? Option A, it involves the transfer of pathogens by food and water. Option B, it involves contaminated instruments, needles, or contaminated hands that are not washed. Option C, it involves transmission of pathogens that remain suspended in air for a long period of time. Option D, it refers to the transfer of pathogens by mosquitoes, flies, and rats. The correct answer is option B. It involves contaminated instruments, needles, or contaminated hands that are not washed. Explanation. Indirect contact transmission can occur when pathogens are transferred by contaminated instruments, surfaces, or hands that have not been properly cleaned. Question 18. Protected health information stands for Option A, protected health information. Option B, private health instructions. Option C, private health information. Option D, protected health instructions. The correct answer is option A, protected health information. Explanation. Protected health information is individually identifiable health information that is protected by privacy rules when handled by covered healthcare organizations and their business associates. Question 19. The patient has been given a prescription that says the medication should be taken twice daily. This medication should be taken, Option A, before bedtime. Option B, once a day. Option C, before meals. Option D, twice a day. The correct answer is option D, twice a day. Explanation. Twice daily means the medication is taken 2 times during the day at the intervals directed by the prescriber. Question 20. A quantitative test is one that Option A, tests for the presence and amount of substance in sample. Option B, tests for presence of substance only. Option C, does not require a trained technician. Option D, tests for all substances found in the sample. The correct answer is option A, tests for the presence and amount of substance in sample. Explanation. A quantitative test reports how much of a substance is present, while a qualitative test generally reports whether the substance is present or absent. Question 21. A patient came to the clinic for a low-grade fever of 1 month duration. As part of the laboratory workup, the physician ordered erythrocyte sedimentation rate. What color tube would be used for this test? Option A, green top tube. Option B, light blue top tube. Option C, lavender top tube. Option D, red top tube. The correct answer is option C, lavender top tube. Explanation. The source keys a lavender top tube for erythrocyte sedimentation rate testing. Collection requirements can vary by laboratory method, so the laboratory protocol should be followed. Question 22. Which of the following is considered a parasitic infection? Option A, Lyme disease. Option B, rabies. Option C, ringworm. Option D, malaria. The correct answer is option D, malaria. Explanation. Malaria is caused by Plasmodium parasites that are transmitted through the bite of infected mosquitoes, so it is a parasitic infection rather than a bacterial, viral, or fungal disease. Question 23. Which mode of infection transmission occurs from touching contaminated linens? Option A, droplet contact. Option B, direct contact. Option C, vehicle contact. Option D, indirect contact. The correct answer is option D, indirect contact. Explanation. Contaminated linens act as an intermediate object, so transmission from touching them is classified as indirect contact rather than direct person-to-person contact. Question 24. While Mr. Dillon's hematocrit is spinning in the centrifuge, you perform an automated hemoglobin test on a sample of his blood and record the value as 15 grams per deciliter. You do a quick mental calculation and expect that the hematocrit value will be approximately: Option A, 5 grams per deciliter. Option B, 5%. Option C, 45%. Option D, 45 grams per deciliter. The correct answer is option C, 45%. Explanation. A common screening estimate is that hematocrit is about 3 times the hemoglobin value, so a hemoglobin of 15 grams per deciliter suggests a hematocrit near 45%. Question 25. The body organ targeted by hepatitis B virus is the: Option A, brain. Option B, liver. Option C, heart. Option D, lungs. The correct answer is option B, liver. Explanation. Hepatitis B virus primarily infects liver cells, so the liver is the main organ affected by the disease. Question 26. Name this part of the electrocardiogram. Option A, R2R interval. Option B, ST segment. Option C, PR segment. Option D, QRS complex. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 27. Az's toll. Option A, is defined as the presence of chaotic cardiac activity. Option B, produces a complete cessation of cardiac output. Option C, is the most common primary event in cardiac arrest in the adult. Option D, appears as a chaotic line on the electrocardiogram monitor. The correct answer is option B, produces a complete cessation of cardiac output. Explanation. Az's toll means the absence of effective ventricular electrical activity and therefore no effective cardiac output. Question 28. After obtaining an electrocardiogram tracing, a medical assistant would be expected to: Option A, check the patient with a pulse oximeter to verify accuracy of the electrocardiogram tracing. Option B, evaluate the patient's medication list for cardiac-altering drugs. Option C, instruct the patient on the tracing results and cardiac prognosis. Option D, observe the tracing for quality and decide if another tracing may be required. The correct answer is option D, observe the tracing for quality and decide if another tracing may be required. Explanation. After recording an electrocardiogram, the medical assistant should check the tracing for artifact and technical quality and repeat it when necessary rather than interpret the diagnosis for the patient. Question 29. This is federal program that provides medical care for the indigent. Option A, Public Health Service. Option B, Medicaid. Option C, Medicare. Option D, Health Insurance Portability and Accountability Act. The correct answer is option B, Medicaid. Explanation. Medicaid is a joint federal and state program that provides health coverage to eligible people with limited income and other qualifying circumstances. Question 30. Choose the answer that corresponds with number C. Option A, radial artery. Option B, brachial artery. Option C, ulnar artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 31. A routine hand wash procedure uses plain soap to remove soil and transient bacteria. Option A, scrub brushes. Option B, antimicrobial soap. Option C, gel-based creams after the routine hand wash. Option D, medicated towels for drying clean hands. The correct answer is option B, antimicrobial soap. Explanation. The source keys antimicrobial soap, but the stem states that routine handwashing uses plain soap. This item is internally inconsistent and should be reviewed against the original course material before use. Question 32. Insulin syringes are calibrated in Option A, milliliters, Option B, units, Option C, cubic centimeters, Option D, minims. The correct answer is Option B, units. Explanation. Insulin syringes are marked in insulin units so the ordered dose can be measured according to the insulin concentration. Question 33. Which of the following would be filled second? Option A, Tommy Turner, Option B, Thomas Turner, Option C, Tom A. Turner, Option D, Tommy Turner. The correct answer is Option C, Tom A. Turner. Explanation. The keyed filing order places Tom A. Turner second when the names are alphabetized according to the filing rules used in the source material. Question 34. The patient complains that it hurts when they swallow. This type of complaint is considered Option A, assessment, Option B, plan, Option C, objective, Option D, subjective. The correct answer is Option D, subjective. Explanation. Pain with swallowing is a symptom reported by the patient, so it is subjective information rather than an objective finding directly measured by the examiner. Question 35. A phlebotomist enters a room to draw blood on a patient who is hospitalized with an infected wound. The site of the wound and any of its bandages are considered which link in the chain of infection? Option A, portal of exit, Option B, susceptible host, Option C, infectious agent, Option D, mode of transmission. The correct answer is Option A, portal of exit. Explanation. An infected wound can release microorganisms into the environment, making the wound and contaminated drainage or dressings a portal of exit in the chain of infection. Question 36. Identify the following rhythm. Option A, atrial fibrillation, Option B, ventricular fibrillation, Option C, junctional tachycardia, Option D, asystole. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 37. When analysis of a patient flow is reviewed, what does this help a practice determine? Option A, the day of the week that most patients come in. Option B, the number of times per year a patient visits the medical office. Option C, the amount of time the provider sees patients per week. Option D, the realistic time frame for each appointment. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 38. Sodium citrate is the additive in what color tube? Option A, red, Option B, green, Option C, light blue, Option D, lavender. The correct answer is Option C, light blue. Explanation. Light blue tubes contain sodium citrate, an anticoagulant used primarily for coagulation testing because it binds calcium in a controlled ratio. Question 39. Which of the following is known as swimmer's ear? Option A, otitis externa, Option B, otitis, Option C, otitis media, Option D, otitis interna. The correct answer is Option A, otitis externa. Explanation. Otitis externa is inflammation or infection of the external ear canal and is commonly called swimmer's ear. Question 40. Telephone etiquette involves Option A, remaining anonymous to avoid any responsibility, Option B, leaving a person on hold until you have the answer, Option C, referring an emotional caller to the administrator, Option D, keeping your statements simple and to the point. The correct answer is Option D, keeping your statements simple and to the point. Explanation. Clear, brief statements make telephone communication easier to understand and reduce confusion, especially when giving routine office information. Question 41. While taking a patient's medical history for active tuberculosis, what type of personal protective equipment is required? Option A, goggles, Option B, lab coat, Option C, gloves, Option D, mask. The correct answer is Option D, mask. Explanation. Active tuberculosis is spread through airborne particles, so respiratory protection is required when entering or interviewing a patient with suspected or confirmed infectious tuberculosis. Question 42. Choose the answer that corresponds with number E. Option A, basilic vein, Option B, radial artery, Option C, cephalic vein, Option D, median cubital vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 43. Which chest lead is placed on the right sternum border in the fourth intercostal space? Option A, V3, option B, V1, option C, V2, option D, V4. The correct answer is option B, V1. Explanation. Chest lead V1 is placed at the fourth intercostal space along the right sternal border. Question 44. Aspirin and acetaminophen are examples of option A, analgesics and antipyretics, option B, antitussives and decongestants, option C, antihistamines and antiemetics, option D, antidotes and antibiotics. The correct answer is option A, analgesics and antipyretics. Explanation. Aspirin and acetaminophen reduce pain and can lower fever, which makes them analgesic and antipyretic medications. Question 45. A female patient came into the emergency room due to vaginal bleeding. What is the name of the instrument used to hold open the wall of the vagina? Option A, retractor, option B, speculum, option C, hemostat, option D, forceps. The correct answer is option B, speculum. Explanation. A speculum is used to separate and hold open the vaginal walls so the cervix and vaginal canal can be examined. Question 46. The patient's specimen is lipemic. This is usually an indicator that the patient is option A, smoking, option B, not fasting, option C, normal, option D, in basal state. The correct answer is option B, not fasting. Explanation. Lipemia makes serum or plasma look cloudy or milky because of excess circulating lipids and can occur when a patient has not fasted before collection. Question 47. What does this symbol represent? Option A, chemical hazard, option B, biologic hazard, option C, radioactive hazard, option D, Sharp's hazard. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 48. When using a number 10 envelope, where should the address be placed? Option A, 10 lines down from the top and 4 inches from the left edge of the envelope. Option B, 14 lines down from the top and 2 inches from the left edge of the envelope. Option C, 10 lines down from the top and 2 inches from the left edge of the envelope. Option D, 14 lines down from the top and 4 inches from the left edge of the envelope. The correct answer is option C, 10 lines down from the top and 2 inches from the left edge of the envelope. Explanation. The keyed placement centers the delivery address in the standard address area of a number 10 envelope so automated postal equipment can read it properly. Question 49. The interval between exposure to infection and the appearance of the first symptom is called option A, incubation period, option B, active period, option C, means of transmission period, option D, incineration period. The correct answer is option A, incubation period. Explanation. The incubation period is the time between exposure to an infectious agent and the appearance of the first signs or symptoms of disease. Question 50. Managed care organizations control costs by option A, limiting patient enrollment, option B, detecting risk factors early, option C, discouraging patient visits, option D, eliminating case managers. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 51. Which of the following precautions require special air handling and ventilation? Option A, contact precautions. Option B, standard precautions. Option C, airborne precautions. Option D, droplet precautions. The correct answer is option C, airborne precautions. Explanation. Airborne precautions require special ventilation because very small infectious particles can remain suspended in the air and travel beyond the immediate patient area. Question 52. Choose the answer that corresponds with number D. Option A, ulnar artery. Option B, radial artery. Option C, brachial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 53. Which drug is used as an anticoagulant? Option A, fluoxetine Prozac. Option B, warfarin Coumadin. Option C, digoxin Lanoxin. Option D, triazolam halcyon. The correct answer is option B, warfarin Coumadin. Explanation. Warfarin is an anticoagulant that reduces formation of vitamin K-dependent clotting factors and is used to reduce the risk of harmful blood clots. Question 54. What drug prevents the action of another drug or chemical? Option A, trade. Option B, narcotic. Option C, synergist. Option D, antagonist. The correct answer is option D, antagonist. Explanation. An antagonist blocks or reduces the action of another drug or chemical by opposing its effect at a receptor or through another mechanism. Question 55. You are to draw the blood of a patient. After reviewing the lab order, you realize that you need to draw a complete blood count with differential on your patient. Knowing that this test is drawn in a lavender top tube, which lab department would this go to for processing? Option A, microbiology. Option B, hematology. Option C, coagulation. Option D, chemistry. The correct answer is option B, hematology. Explanation. A complete blood count with differential evaluates blood cells, so the specimen is processed in hematology rather than chemistry, microbiology, or coagulation. Question 56. Which is the most common route of administration of nitroglycerin? Option A, intravenous. Option B, intradermal. Option C, suppository. Option D, sublingual. The correct answer is option D, sublingual. Explanation. Sublingual nitroglycerin is placed under the tongue for rapid absorption, which allows a quick effect when it is prescribed for acute angina symptoms. Question 57. Which is an example of a recommended preventive procedure? Option A, eating the recommended daily allowances. Option B, teeth whitening. Option C, childhood immunizations. Option D, daily exercise. The correct answer is option C, childhood immunizations. Explanation. Childhood immunizations are preventive because they reduce the risk of developing specific infectious diseases before illness occurs. Question 58. Material safety data sheet information includes: Option A, table of chemical elements. Option B, product manufacturing conditions. Option C, general and emergency information. Option D, information on competitor products. The correct answer is option C, general and emergency information. Explanation. A material safety data sheet provides safety information about a chemical, including hazards, safe handling, first aid, and emergency response information. Question 59. The method of scheduling in which one patient is scheduled for a specific appointment time is known as: Option A, single booking. Option B, standard scheduling. Option C, cluster scheduling. Option D, fixed appointment scheduling. The correct answer is option A, single booking. Explanation. Single booking schedules one patient for one specific appointment time, giving each patient an individual time slot. Question 60. Which of the patient's limbs serves as an electrical ground? Option A, right arm. Option B, left leg. Option C, left arm. Option D, right leg. The correct answer is option D, right leg. Explanation. In a standard electrocardiogram setup, the right leg electrode serves as the reference or ground electrode and is not used to form the main diagnostic limb leads. Question 61. What drug enhances the effects of another drug? Option A, narcotic. Option B, antagonist. Option C, trade. Option D, synergistic. The correct answer is option D, synergistic. Explanation. A synergistic drug interaction occurs when one drug increases or enhances the effect of another drug. Question 62. During assessment, the best source from which to obtain patient information is the: Option A, the medical record. Option B, physician's notes. Option C, a family member. Option D, the physician. The correct answer is option A, the medical record. Explanation. The medical record is the organized source of documented patient information, including history, medications, allergies, prior findings, and treatment information. Question 63. The National Health Insurance Plan for Americans age 65 and older is: Option A, Civilian Health and Medical Program of the Department of Veterans Affairs. Option B, Medicaid. Option C, TRICARE. Option D, Medicare. The correct answer is option D, Medicare. Explanation. Medicare is the federal health insurance program that primarily covers people age 65 and older and also covers certain younger people who meet eligibility criteria. Question 64. Which of the following is a standard speed for an electrocardiogram machine? Option A, 50 mm per second. Option B, 100 mm per second. Option C, 10 mm per second. Option D, 25 mm per second. The correct answer is option D, 25 mm per second. Explanation. A standard electrocardiogram paper speed is 25 mm per second, which provides the usual time scale for measuring intervals and rates. Question 65. The functional unit of the kidney is the: Option A, nephron. Option B, ureter. Option C, urethra. Option D, bladder. The correct answer is option A, nephron. Explanation. The nephron is the microscopic functional unit of the kidney that filters blood and helps form urine. Question 66. To indicate that something lies nearer the surface, use the term. Option A, distal. Option B, deep. Option C, superficial. Option D, proximal. The correct answer is option C, superficial. Explanation. Superficial means closer to or at the body surface, while deep describes a structure farther from the surface. Question 67. The patient information sheet contains. Option A, the past medical history of the patient. Option B, the patient's past family history. Option C, the patient's chief complaint. Option D, patient's personal and insurance information. The correct answer is option D, patient's personal and insurance information. Explanation. The patient information sheet is used to collect identifying, contact, and insurance information needed for registration, billing, and communication. Question 68. The term refers to the list of charges for each of the provider's services. Option A, fee schedule. Option B, coinsurance. Option C, copayment. Option D, cost sheet. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 69. Most exposures to human immunodeficiency virus in healthcare settings are the result of. Option A, contact with acquired immunodeficiency syndrome patients. Option B, splashes during surgery. Option C, accidental needle sticks. Option D, tainted blood transfusions. The correct answer is option C, accidental needle sticks. Explanation. Needle stick injuries are a major occupational route of exposure to bloodborne pathogens because contaminated sharps can introduce infected blood directly through the skin. Question 70. A physician, specialist, or any person that provides medical care is known as the. Option A, provider. Option B, policyholder. Option C, subscriber. Option D, dependent. The correct answer is option A, provider. Explanation. A provider is a healthcare professional or organization that supplies medical services to patients. Question 71. Another term for outpatient care is. Option A, rehabilitation care. Option B, non-ambulatory care. Option C, ambulatory care. Option D, nursing home care. The correct answer is option C, ambulatory care. Explanation. Ambulatory care means healthcare provided without an overnight hospital admission, so it is another term for outpatient care. Question 72. The ability to identify with someone else's feelings is called. Option A, respect. Option B, feedback. Option C, sympathy. Option D, empathy. The correct answer is option D, empathy. Explanation. Empathy is the ability to understand and identify with another person's feelings while maintaining an appropriate professional perspective. Question 73. Automaticity refers to. Option A, the ability of the myocardial cell to contract when stimulated by an electrical impulse. Option B, the ability to transmit an electrical stimulus from cell to cell throughout the myocardium. Option C, the ability to respond to an electrical stimulus. Option D, the ability of certain myocardial cells to produce an electrical impulse without the need for outside nerve stimulation. The correct answer is option D. The ability of certain myocardial cells to produce an electrical impulse without the need for outside nerve stimulation. Explanation. Automaticity is the ability of certain cardiac cells to generate electrical impulses spontaneously without an external nerve signal. Question 74. The mental and emotional condition, enthusiasm, loyalty, or confidence of an individual or group with regard to function or tasks at hand is called. Option A, morale. Option B, insubordination. Option C, initiative. Option D, tenacity. The correct answer is option A, morale. Explanation. Morale describes the confidence, enthusiasm, and emotional outlook of an individual or group toward its work and responsibilities. Question 75. Faithfulness, or allegiance to a cause, ideal, custom, institution or product, is called. Option A, loyalty. Option B, dependability. Option C, courtesy. Option D, flexibility. The correct answer is option A, loyalty. Explanation. Loyalty means faithfulness or allegiance to a person, organization, cause, or principle. Question 76. Another name for chest leads is. Option A, standard. Option B, precordial. Option C, limb. Option D, augmented. The correct answer is option B, precordial. Explanation. Precordial leads are the chest leads placed across the front of the chest to view electrical activity from different horizontal angles. Question 77. What is the process used to wash and remove blood and tissue from medical instruments called? Option A, asepsis. Option B, sanitization. Option C, disinfection. Option D, sterilization. The correct answer is option B, sanitization. Explanation. Sanitization is the cleaning step that removes visible soil, blood, and tissue from instruments before higher-level disinfection or sterilization when required. Question 78. There are two types of civil actions healthcare providers for injuries resulting from healthcare. The first one is lack of informed consent and the second one is option A, violation of standard of care. Option B, trial and post-trial. Option C, violation of confidentiality. Option D, violation of continued care plan. The correct answer is option A, violation of standard of care. Explanation. A violation of the standard of care occurs when a healthcare provider fails to act with the level of skill and care expected under similar circumstances. Question 79. A patient has an oral temperature of 100.8 degrees Fahrenheit. The medical term for this is option A, pyrexia. Option B, pyuria. Option C, hyperpyrexia. Option D, purulent. The correct answer is option A, pyrexia. Explanation. Pyrexia means fever, so an oral temperature above the normal range may be described as pyrexia. Question 80. Which of the following is the best specimen to test for levels of iron in the blood? Option A, the one collected in a tube that contains sodium citrate. Option B, the one collected in a microcuvette. Option C, the one collected in the tube that contains ethylenediamine tetrasic acid. Option D, the one collected in a tube with no additive. The correct answer is option C, the one collected in the tube that contains ethylenediamine tetrasic acid. Explanation. The source keys the tube containing ethylenediamine tetrasic acid. Because iron testing methods can depend on the laboratory protocol, this item should be checked against the specific course or laboratory standard being used. Question 81. No anticoagulants are found in which of the following tubes? Option A, green-topped. Option B, yellow-topped. Option C, lavender-topped. Option D, red-topped. The correct answer is option D, red-topped. Explanation. A plain red-topped tube traditionally contains no anticoagulant, allowing the blood to clot so serum can be separated after centrifugation. Question 82. When using a ventrogluteal approach to give an intramuscular injection in the buttock area, what is the muscle the medication goes in? Option A, gluteus maximus. Option B, gluteus medius. Option C, right upper and outer quadrant. Option D, gluteus minimus. The correct answer is option B, gluteus medius. Explanation. The ventrogluteal intramuscular site overlays the gluteus medius and is selected because it provides a thick muscle mass away from major nerves and blood vessels. Question 83. A female patient came into the office for her scheduled routine physical. You are measuring the patient's vital signs. Which part of the brain is responsible for the temperature regulation? Option A, hypothalamus. Option B, thalamus. Option C, medulla oblongata. Option D, pons. The correct answer is option A, hypothalamus. Explanation. The hypothalamus helps regulate body temperature by comparing internal temperature signals with the body's set point and triggering heat loss or heat conservation responses. Question 84. The amount of blood pumped by the heart per minute is called. Option A, ejection fraction. Option B, cardiac output. Option C, contractility. Option D, blood pressure. The correct answer is option B, cardiac output. Explanation. Cardiac output is the volume of blood the heart pumps in 1 minute and is commonly described as heart rate multiplied by stroke volume. Question 85. A baby's pulse and respirations are: Option A, the same as adults. Option B, not significantly different than an adult. Option C, faster than an adult's. Option D, slower than an adult's. The correct answer is option C, faster than an adult's. Explanation. Infants normally have faster heart rates and respiratory rates than adults because of their smaller body size and higher metabolic demand. Question 86. Choose the answer that corresponds with letter F. Option A, basilic vein. Option B, medicancubital vein. Option C, radial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 87. A murmur is an abnormal sound that may indicate: Option A, intestinal obstruction. Option B, valvular heart disease. Option C, stroke. Option D, bronchial asthma. The correct answer is option B, valvular heart disease. Explanation. A heart murmur is an extra or unusual sound caused by turbulent blood flow and may be associated with abnormal heart valves. Question 88. What does the inside address in a typewritten letter need to include? Option A, the salutation. Option B, the body of the letter. Option C, the name and address of the person sending the letter. Option D, the name and address of the person receiving the letter. The correct answer is option D, the name and address of the person receiving the letter. Explanation. The inside address identifies the recipient of a business letter by giving the recipient's name and mailing address before the salutation. Question 89. Which of the following supplies blood to the heart muscle? Option A, coronary arteries. Option B, brachial arteries. Option C, carotid arteries. Option D, cerebral arteries. The correct answer is option A, coronary arteries. Explanation. The coronary arteries branch from the aorta and deliver oxygenated blood directly to the heart muscle. Question 90. Samples appear to have been mislabeled and mixed on 2 patients. Each outpatient has orders for both blood and urine test, so there were 2 samples for each. What would be the best course of action? Option A, recollect all 4 specimens from the patients. Option B, relabel the urine samples, but redraw the blood. Option C, have the patients come back and identify their specimens. Option D, relabel all the specimens. The correct answer is option A, recollect all 4 specimens from the patients. Explanation. When patient specimens may be mislabeled, the safest action is to reject the questionable specimens and recollect them using correct identification procedures rather than guess which sample belongs to whom. Question 91. Sinus is a slow dysrhythmia. Option A, bradycardia. Option B, tachycardia. Option C, rhythm. Option D, dysrhythmia. The correct answer is option A, bradycardia. Explanation. Sinus bradycardia is a sinus rhythm with a slower than expected rate because the sinoatrial node is firing slowly. Question 92. When performing a dermal puncture and the lancet hits the bone, what is the potentially serious fatal bone infection that could occur? Option A, osteochondritis. Option B, osteomyelitis. Option C, osteomalacia. Option D, osteoporosis. The correct answer is option B, osteomyelitis. Explanation. Osteomyelitis is an infection of bone. A lancet that penetrates too deeply during a dermal puncture can potentially introduce infection near the bone. Question 93. This unit in the hospital is run by physicians and experts in the field of musculoskeletal disorders of bones, joints, ligaments and tendons. Identify this department. Option A, rheumatology. Option B, obstetrics. Option C, ophthalmology. Option D, oncology. The correct answer is option A, rheumatology. Explanation. Rheumatology focuses on disorders involving joints and connective tissues, including many conditions that affect bones, ligaments, tendons, and surrounding structures. Question 94. Important information a patient should know about immunizations would be that: Option A, they are not necessary if quality infection is maintained. Option B, they are prophylactics against deadly diseases. Option C, they are known to cause autism. Option D, they can unintentionally give the recipient a disease. The correct answer is option B, they are prophylactics against deadly diseases. Explanation. Immunizations are preventive measures that prepare the immune system to respond to specific infectious diseases before exposure causes serious illness. Question 95. The 4 symptoms of inflammation are erythema, edema, pain, and Option A, irritation. Option B, vomiting. Option C, heat. Option D, headache. The correct answer is option C, heat. Explanation. The classic local signs of inflammation include redness, swelling, pain, and heat caused by increased blood flow and inflammatory activity in the affected area. Question 96. A fluctuating fever that returns to or below baseline then increases again is: Option A, intermittent. Option B, remittent. Option C, onset. Option D, continuous. The correct answer is option A, intermittent. Explanation. An intermittent fever returns to normal or below the fever threshold between episodes before rising again. Question 97. The normal volume of urine produced by an adult in a 24-hour period generally does not exceed: Option A, 2,000 liters. Option B, 2,000 milliliters. Option C, 400 milliliters. Option D, 750 milliliters. The correct answer is option B, 2000 milliliters. Explanation. The source uses about 2000 milliliters as the upper end of typical daily adult urine output, although normal output varies with intake and clinical condition. Question 98. Family members, such as spouse or children that are covered under the member's insurance policy are known as Option A, members. Option B, beneficiaries. Option C, dependents. Option D, subscribers. The correct answer is option C, dependents. Explanation. Dependents are eligible family members, such as a spouse or children, who receive coverage under the insured person's health plan according to the plan's rules. Question 99. Which choice is a typical educational for elderly patients to prevent disease? Option A, the location of the patient's public health resources in their community. Option B, health anti-aging skin care techniques and products. Option C, sterile technique used in the medical practice. Option D, annual flu pneumonia vaccination information. The correct answer is option D, annual flu pneumonia vaccination information. Explanation. Vaccination education is an important preventive topic for older adults because immunization can reduce the risk of serious respiratory infections and related complications. Question 100. The three kinds of blood cells are: Option A, leukocytes, red blood cells, erythrocytes. Option B, erythrocytes, platelets, thrombocytes. Option C, leukocytes, white blood cells, platelets. Option D, erythrocytes, thrombocytes, leukocytes. The correct answer is option D, erythrocytes, thrombocytes, leukocytes. Explanation. The three major formed elements of blood are erythrocytes, leukocytes, and thrombocytes, which are red blood cells, white blood cells, and platelets. Question 101. Also known as problem-oriented medical record, is a method of tracking the patient's problems during the time they are receiving medical care. Option A, problem-oriented model records. Option B, problems on medical records. Option C, problem-oriented medical record charting. Option D, prognosis on medical record charting. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 102. Issues relating to medical advances come under the heading of Option A, malfeasance. Option B, religious freedom. Option C, bioethics. Option D, ethics. The correct answer is option C, bioethics. Explanation. Bioethics applies ethical principles to questions created by medicine, biology, healthcare technology, research, and advances in treatment. Question 103. A patient has a possible corneal abrasion and needs a referral. Which specialty is a physician that deals with eye injury and disease? Option A, ophthalmologist. Option B, oncologist. Option C, optician. Option D, optometrist. The correct answer is option A, ophthalmologist. Explanation. An ophthalmologist is a physician who diagnoses and treats eye diseases and injuries and can provide medical and surgical eye care. Question 104. Which of the following types of gloves can be decontaminated and reused if they show no signs of deterioration after use? Option A, disposable. Option B, utility. Option C, sterile. Option D, examination. The correct answer is option B, utility. Explanation. Utility gloves are heavy-duty reusable gloves that may be cleaned and decontaminated if they remain intact and show no signs of deterioration. Question 105. Which of the following is an example of proxemics? Option A, eye contact. Option B, facial expression. Option C, personal contact. Option D, personal hygiene. The correct answer is option B, facial expression. Explanation. The source keys facial expression, but proxemics concerns the use of personal space and physical distance in communication. This item should be reviewed because the supplied key appears inconsistent with standard terminology. Question 106. What specimens require protection from light? Option A, bilirubin. Option B, lactic acid. Option C, blood gases. Option D, cryofibrinogens. The correct answer is option A, bilirubin. Explanation. Bilirubin breaks down when exposed to light, so specimens for bilirubin testing are protected from light to help preserve an accurate result. Question 107. After a patient interview by the medical assistant, which of the following should not be recorded by the medical assistant? Option A, family medical history. Option B, examination narrative. Option C, chief complaint. Option D, medication allergies. The correct answer is option B, examination narrative. Explanation. The medical assistant may document information obtained during the interview, but the provider's examination narrative belongs to the provider's clinical examination and should not be independently created by the assistant. Question 108. The function of the platelet is to: Option A, cause the blood to clot. Option B, fight infection. Option C, carry oxygen. Option D, carry nutrients. The correct answer is option A, cause the blood to clot. Explanation. Platelets are essential for primary hemostasis because they adhere to damaged blood vessels, aggregate, and help form the initial platelet plug. Question 109. Which of the following vacutainer tubes is routinely used for hematology testing? Option A, light blue top tubes. Option B, red top tubes. Option C, lavender top tubes. Option D, green top tubes. The correct answer is option C, lavender top tubes. Explanation. Lavender top tubes contain ethylenediamine tetrashic acid, which preserves blood cell morphology and is widely used for hematology tests such as a complete blood count. Question 110. Which of the following is classified as abnormally rapid, deep, or labored breathing? Option A, hypertension. Option B, tachypnea. Option C, hypernia. Option D, hyperpyrexia. The correct answer is option B, tachypnea. Explanation. The source keys tachypnea. Tachypnea specifically means abnormally rapid breathing, while deep or labored breathing may be described with other respiratory terms, so the wording should be reviewed. Question 111. When the body has had adequate rest and no food for at least 12 hours, it is said to be in: Option A, hemostasis. Option B, basal state. Option C, homeostasis. Option D, steady state. The correct answer is option B, basal state. Explanation. Basal state describes the body after adequate rest and fasting, when metabolic activity is measured under relatively standardized resting conditions. Question 112. Thixotropic gel, found in the serum separator tube, red-gray marbled topped vacutainer tube. Option A, is more dense than red blood cells and less dense than white blood cells. Option B, is more dense than red blood cells and less dense than serum. Option C, is less dense than red blood cells but more dense than serum. Option D, has the same density as red blood cells. The correct answer is option C, is less dense than red blood cells but more dense than serum. Explanation. During centrifugation, separator gel moves between the denser blood cells and the less dense serum, creating a stable physical barrier between them. Question 113. Postprandial means: Option A, before a meal. Option B, before bedtime. Option C, fasting. Option D, after a meal. The correct answer is option D, after a meal. Explanation. Postprandial means after a meal, so a postprandial measurement or instruction is timed after eating. Question 114. In a standard 12-lead electrocardiogram, the measurement of current that the heart muscle produces between the right arm electrode and left arm electrode is known as the: Option A, standard limb lead 3. Option B, augmented lead. Option C, standard limb lead 2. Option D, standard limb lead 1. The correct answer is option D, standard limb lead 1. Explanation. Standard limb lead 1 records the electrical potential difference between the right arm and left arm electrodes. Question 115. Two employees discussing a patient diagnosis on a hospital elevator with other people present is a violation of: Option A, patient rights. Option B, patient privacy. Option C, patient confidentiality. Option D, patient insurance. The correct answer is option C, patient confidentiality. Explanation. Discussing a patient's diagnosis where unauthorized people can hear it exposes confidential health information and violates the duty to protect patient confidentiality. Question 116. Which of the following blood pressure readings would be considered stage 1 hypertension? Option A, 148/96. Option B, 116/72. Option C, 126/84. Option D, 178/104. The correct answer is option A, 148/96. Explanation. The source classifies 148/96 as stage 1 hypertension. Blood pressure categories can vary by guideline and era, so use the classification system required by the course. Question 117. The patient's chart indicates a urine sample was collected at 1800. This means the sample was collected at: Option A, 8 inches the morning. Option B, 8 inches the evening. Option C, 6 inches the morning. Option D, 6 inches the evening. The correct answer is option D, 6 inches the evening. Explanation. Military time 1800 corresponds to 6 inches the evening because times afternoon are converted by subtracting 12 from the hour number. Question 118. A 67-year-old man comes into the doctor's office for a regular checkup. The doctor orders an electrocardiography to be done on the patient. There is junctional escape beat noticed by you. What is the origin of this rhythm? Option A, atrioventricular node. Option B, bundle branches. Option C, ventricle. Option D, sinus node. The correct answer is option A, atrioventricular node. Explanation. A junctional escape beat originates in tissue near the atrioventricular junction when the normal pacemaker fails to fire or its impulse does not reach the ventricles. Question 119. Which body system has the liver, gallbladder and pancreas as accessory organs? Option A, digestive. Option B, endocrine. Option C, integumentary. Option D, lymphatic. The correct answer is option A, digestive. Explanation. The liver, gallbladder, and pancreas are accessory organs of digestion because they produce, store, or deliver substances that help digest food. Question 120. A patient's weight should be listed in the patient's chart to the nearest. Option A, pound. Option B, 1/2 pound. Option C, ounce. Option D, 1/4 pound. The correct answer is option D, 1/4 pound. Explanation. The source keys 1/4 pound as the charting precision. This is a documentation convention from the source and should be matched to the policy or equipment standard used in the course. Question 121. The main purpose of personal protective equipment is to: Option A, help project a professional appearance. Option B, protect street clothes from getting soiled. Option C, provide the employee a barrier against infection. Option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. The correct answer is option C, provide the employee a barrier against infection. Explanation. Personal protective equipment creates a barrier between the worker and potentially infectious material, reducing exposure to blood, body fluids, droplets, or other hazards. Question 122. The hormone tested for in pregnancy tests is: Option A, thyroid stimulating hormone. Option B, progesterone. Option C, estrogen. Option D, human chorionic gonadotropin. The correct answer is option D, human chorionic gonadotropin. Explanation. Pregnancy tests detect human chorionic gonadotropin, a hormone produced after implantation and released in increasing amounts early in pregnancy. Question 123. What is the name of the law that protects healthcare workers who gave aid during the time of an accident? Option A, Good Samaritan Law. Option B, Megan's Law. Option C, Right to Know Law. Option D, Health Insurance Portability and Accountability Act. The correct answer is option A, Good Samaritan Law. Explanation. Good Samaritan laws are intended to provide certain legal protections to people who voluntarily give emergency assistance in good faith, although the exact protections vary by jurisdiction. Question 124. When would a phlebotomist use a multiple sample needle? Option A, along family members who all require the same test. Option B, in a large outpatient laboratory for all patients requiring the same test. Option C, for microcapillary collection. Option D, when more than one tube of blood is to be collected. The correct answer is option D, when more than one tube of blood is to be collected. Explanation. A multiple sample needle allows several evacuated tubes to be filled during one venipuncture without removing the needle from the patient's vein. Question 125. A 45-year-old man comes in for a stress test. His resting blood pressure is 120/80. During the stress test, his blood pressure dropped to 95/55 and his skin is cold and clammy. What is the best course of action? Option A, stop for a minute, then resume. Option B, stop the test immediately. Option C, slow the test and then pick the pace back up. Option D, push forward with the test. The correct answer is option B, stop the test immediately. Explanation. A major blood pressure drop with cold, clammy skin during a stress test suggests poor tolerance and possible circulatory compromise, so the test should be stopped immediately for patient safety. Question 126. If a laboratory test requires serum, which vacutainer tube is the tube of choice? Option A, lavender top tubes. Option B, black top tubes. Option C, yellow top tubes. Option D, red top tubes. The correct answer is option D, red top tubes. Explanation. A red top tube allows blood to clot so serum can be separated, making it appropriate for tests that require serum. Question 127. A monitor that a patient wears for 24 hours is called an. Option A, Holter. Option B, 12-lead. Option C, Holter. Option D, echocardiogram. The correct answer is option C, Holter. Explanation. A Holter monitor records the heart's electrical activity continuously during normal daily activities, commonly for about 24 hours or longer. Question 128. Information given by a patient to medical personnel that cannot be disclosed without consent constitutes. Option A, duty of care. Option B, negligence. Option C, judgment. Option D, privileged communication. The correct answer is option D, privileged communication. Explanation. Privileged communication is confidential information shared within a protected professional relationship and is not normally disclosed without authorization or another lawful basis. Question 129. Identify the tubes needed to collect a prothrombin time, immediate electrolytes, and blood culture in the proper order of collection. Option A, yellow, light blue, plasma separator tube. Option B, serum separator tube, yellow, light blue. Option C, light blue, lavender, yellow. Option D, gold, yellow, light blue. The correct answer is option A, yellow, light blue, plasma separator tube. Explanation. The keyed sequence places the blood culture collection first, followed by the light blue coagulation tube and then the plasma separator tube for electrolytes. Question 130. The primary purpose of wearing gloves during phlebotomy procedures is to protect the Option A, venipuncture site from contamination by the phlebotomist's hands. Option B, specimen from contamination by the phlebotomist. Option C, patient from contamination by the phlebotomist. Option D, phlebotomist from exposure to the patient's blood. The correct answer is option D, phlebotomist from exposure to the patient's blood. Explanation. Gloves provide a barrier that reduces the phlebotomist's direct skin exposure to the patient's blood and other potentially infectious material. Question 131. Which limb sensor is the reference or ground electrode? Option A, right arm. Option B, left arm. Option C, left leg. Option D, right leg. The correct answer is option D, right leg. Explanation. The right leg sensor serves as the reference or ground electrode in the standard electrocardiogram limb electrode arrangement. Question 132. Which of the following procedures can be performed by a medical assistant? Option A, intramuscular injection. Option B, start fluids through a catheter. Option C, insert peripheral catheter. Option D, intravenous injection. The correct answer is option A, intramuscular injection. Explanation. Intramuscular injections are within the usual delegated clinical duties of a properly trained medical assistant when permitted by state law and office policy, while intravenous procedures may require different authorization. Question 133. Which of the following drug administration routes is the most appropriate for a patient who has nausea and vomiting? Option A, nasal. Option B, buccal. Option C, sublingual. Option D, rectal. The correct answer is option D, rectal. Explanation. The rectal route can be useful when nausea and vomiting make swallowing or retaining an oral medication difficult. Question 134. A provider withdraws from the care of a patient without reasonable notice of discharge is considered. Option A, abandonment. Option B, malpractice. Option C, negligence. Option D, slander. The correct answer is option A, abandonment. Explanation. Abandonment occurs when a provider ends the professional relationship without reasonable notice or without giving the patient a reasonable opportunity to obtain continued care. Question 135. Which of the following should be used to chill a specimen as it transported? Option A, a small freezer unit. Option B, frozen blocks of ice. Option C, crushed ice. Option D, tepid water. The correct answer is option C, crushed ice. Explanation. Crushed ice surrounds the specimen closely and provides efficient chilling when a test requires transport at a low temperature. Question 136. What organ's main function is to eliminate excess water and waste products from the body? Option A, liver. Option B, intestines. Option C, gallbladder. Option D, kidneys. The correct answer is option D, kidneys. Explanation. The kidneys filter the blood, remove metabolic waste, regulate water and electrolytes, and excrete excess substances in urine. Question 137. The principal advantage of using wave method when designing the scheduling process is that it, Option A, provides more breaks for staff. Option B, allows flexibility to accommodate the unpredictable. Option C, gives priority to established patients. Option D, enables the physician to see more patients each day. The correct answer is option B, allows flexibility to accommodate the unpredictable. Explanation. Wave scheduling builds flexibility into the schedule by grouping several patients near the same time so the office can absorb delays, variable visit lengths, and unexpected events. Question 138. Health policies that concern a patient's constitutional right to privacy, informed consent and confidentiality are part of Option A, medical statutes. Option B, Patient's Bill of Rights. Option C, consent laws. Option D, disclosure laws. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 139. Mr. Matthews called the office to get the test results for his wife, Martha. What should the medical assistant do? Option A, tell Mr. Matthews that you cannot release the information. Option B, check the medical record to see if Mr. Matthews is really Martha's husband, if so then release the information. Option C, tell Mr. Matthews the test results. Option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. The correct answer is option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. Explanation. Test results may be released to a spouse only when the patient has authorized that disclosure or another valid legal basis exists, so the medical record must be checked before information is shared. Question 140. Which of the following is the most common means of transmitting pathogens? Option A, ingesting food. Option B, blood transfusions. Option C, coughing. Option D, touching. The correct answer is option D, touching. Explanation. Hands and touch are common ways pathogens move between people and surfaces, which is why hand hygiene is one of the most important infection prevention measures. Question 141. A pounding or racing of the heart, such that the patient is aware of his and her heartbeat, is called an Option A, palpitation. Option B, ectopic beat. Option C, hemoptysis. Option D, arrhythmia. The correct answer is option A, palpitation. Explanation. A palpitation is the sensation of being aware of a forceful, rapid, irregular, or pounding heartbeat. Question 142. An obese patient was sent to the laboratory for a complete blood count. Which of the following veins is MOT likely to be the only that the phlebotomist can palpate? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, sclerosed vein. The correct answer is option B, cephalic vein. Explanation. The cephalic vein lies along the outer side of the arm and may be easier to palpate in some patients when deeper veins are difficult to locate. Question 143. Without a clot activator, whole blood typically clots in minutes. Option A, 60 to 20. Option B, 1 to 2. Option C, 30 to 60. Option D, 5 to 10. The correct answer is option C, 30 to 60. Explanation. Without a clot activator, blood in a plain collection tube may require about 30 to 60 minutes to clot completely before centrifugation. Question 144. Which situation would a medical assistant's signature be required? Option A, after the chief complaint is documented. Option B, after the patient gives a medical history account. Option C, on an informed consent document. Option D, when a patient gives implied consent. The correct answer is option C, on an informed consent document. Explanation. An informed consent document requires signatures to show that the consent process was completed and documented according to office policy and legal requirements. Question 145. The phenylketonuria test is used to diagnose deficiency of phenylalanine hydroxylase, the most common clinically encountered inborn error of metabolism. It is performed on Option A, blood drawn from a newborn's finger. Option B, a newborn's fecal specimen. Option C, blood drawn from a newborn's buttocks. Option D, blood drawn from a newborn's heel. The correct answer is option D, blood drawn from a newborn's heel. Explanation. Newborn screening for phenylketonuria is commonly performed on capillary blood collected by heel puncture and applied to the designated screening medium. Question 146. The amount that an insurance company may say is not allowed and not the responsibility of the patient, for a contracted physician, would be identified as this on the patient's account. Option A, a payment. Option B, an adjustment. Option C, a charge. Option D, a deductible. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 147. Your patient is experiencing chest pain and has a heart rate of 132 beats per minute. You attach the electrocardiogram monitor and see a fast, regular rhythm with a round upright P wave that precedes each QRS complex. The QRS complexes are 0.1 seconds in duration. This patient is experiencing Option A, junctional escape rhythm. Option B, sinus tachycardia. Option C, complete atrioventricular heart block. Option D, idioventricular rhythm. The correct answer is option B, sinus tachycardia. Explanation. A fast regular rhythm with a normal upright P wave before every narrow QRS complex is characteristic of sinus tachycardia because the rhythm is still originating from the sinus node. Question 148. Identify the rhythm that will often produce an irregular rhythm. Option A, atrial tachycardia. Option B, sinus dysrhythmia. Option C, ventricular tachycardia. Option D, sinus bradycardia. The correct answer is option B, sinus dysrhythmia. Explanation. Sinus dysrhythmia produces a rhythm that varies with the respiratory cycle, so the intervals between beats can appear irregular while the impulses still originate in the sinus node. Question 149. Which of the following is correct for ending a venipuncture procedure? Option A, remove the tourniquet, remove the needle, remove the tube, apply pressure. Option B, remove the tourniquet, remove the tube, remove the needle, apply pressure. Option C, remove the needle, remove the tube, remove the tourniquet, apply pressure. Option D, remove the tube, remove the tourniquet, remove the needle, apply pressure. The correct answer is option B, remove the tourniquet, remove the tube, remove the needle, apply pressure. Explanation. Releasing the tourniquet and removing the collection tube before withdrawing the needle reduces venous pressure and helps end the draw safely before pressure is applied. Question 150. Complete destruction of all forms of microbial life. Option A, sterilization. Option B, germicide. Option C, sanitization. Option D, disinfection. The correct answer is option A, sterilization. Explanation. Sterilization destroys all forms of microbial life, including bacterial spores, which distinguishes it from cleaning and most disinfection processes. Question 151. All pathogens are: Option A, microorganisms that live in soil. Option B, microbes that can cause disease. Option C, communicable microorganisms. Option D, normal bacteria found on skin. The correct answer is option B, microbes that can cause disease. Explanation. A pathogen is a microorganism or other infectious agent capable of causing disease in a host. Question 152. The contraction phase of the heartbeat is called: Option A, systole. Option B, diastole. Option C, tachycardia. Option D, pacemaker. The correct answer is option A, systole. Explanation. Systole is the contraction phase of the cardiac cycle, when the ventricles contract and eject blood into the pulmonary artery and aorta. Question 153. The privacy rule gives patients the right to: Option A, access their medical record. Option B, access their ex-spouse's record. Option C, sue the doctor. Option D, refuse treatment. The correct answer is option A, access their medical record. Explanation. The privacy rule gives patients important rights over their health information, including the right to inspect or obtain copies of much of their medical record. Question 154. The medical assistant was sent to the ward to draw blood for coagulation studies. Which of the following is correct about this draw? Option A, the medical assistant can use capillary tubes for the blood collection. Option B, draw a red top tube before the light blue tube. Option C, fill a light blue to the top. Option D, before drawing the specimen, make sure the patient has fasted for 12 hours. The correct answer is option D. Before drawing the specimen, make sure the patient has fasted for 12 hours. Explanation. The source keys a 12-hour fast before coagulation studies, but fasting is not generally the defining requirement for routine coagulation collection. This item should be verified against the course source before use. Question 155. Dr. Jones and Dr. Brown decide to share a practice. Together, they share patients, expenses, profits, and assets. Which type of medical practice is this? Option A, group practice. Option B, clinic. Option C, partnership. Option D, sole proprietorship. The correct answer is option A, group practice. Explanation. A group practice is formed when multiple physicians practice together and share resources such as patients, expenses, income, and facilities. Question 156. Which of the following requires all employees workplace hazard training? Option A, standard precautions. Option B, bloodborne pathogen. Option C, emergency action plans. Option D, hazard communication standard. The correct answer is option D, hazard communication standard. Explanation. The hazard communication standard requires employers to provide information and training about hazardous chemicals that employees may encounter in the workplace. Question 157. What position should the patient be placed in when performing an electrocardiogram? Option A, dorsal recumbent. Option B, supine. Option C, Trendelenburg. Option D, prone. The correct answer is option B, supine. Explanation. The supine position keeps the patient lying flat and relaxed, which helps reduce muscle artifact and allows consistent placement of electrocardiogram electrodes. Question 158. Which of the following is an example of negative kind 6? Option A, smiling. Option B, eye contact. Option C, frowning. Option D, good grooming. The correct answer is option C, frowning. Explanation. Kind 6 refers to body movement and nonverbal expression. Frowning communicates a negative nonverbal message. Question 159. A patient has been taking aspirin for arthritis. Which of the following is most likely to be affected by it? Option A, bleeding time. Option B, glucose time. Option C, blood culture collection. Option D, blood culture results. The correct answer is option A, bleeding time. Explanation. Aspirin inhibits platelet function, so it can prolong bleeding time and increase the tendency to bleed. Question 160. The term used to describe sophisticated and highly complex care is: Option A, managed care. Option B, tertiary care. Option C, secondary care. Option D, primary care. The correct answer is option B, tertiary care. Explanation. Tertiary care is highly specialized, complex care that often involves advanced technology and subspecialty expertise. Question 161. Which of the following are also referred to as serum separator tubes? Serum separator tube. Option A, red and gray top tubes. Option B, red top tubes. Option C, light blue top tubes. Option D, lavender top tubes. The correct answer is option A, red and gray top tubes. Explanation. Red and gray marbled tubes are serum separator tubes because they contain a gel barrier that separates serum from blood cells after centrifugation. Question 162. Muscles that act on the knee joint exhibit two actions. Option A, adduction and lateral rotation. Option B, medial rotation and extension. Option C, adduction and abduction. Option D, flexion and extension. The correct answer is option D, flexion and extension. Explanation. The knee primarily moves through flexion and extension, which bend and straighten the joint. Question 163. Verbal facial expressions or body language, such as a nod of understanding, are called: Option A, external noise. Option B, internal noise. Option C, channels. Option D, feedback. The correct answer is option D, feedback. Explanation. Feedback is the receiver's response that shows whether a message was understood, and it can be verbal or nonverbal, such as a nod. Question 164. A pulse site used to measure blood pressure is: Option A, brachial. Option B, popliteal. Option C, radial. Option D, temporal. The correct answer is option A, brachial. Explanation. The brachial artery is the standard pulse site used with a blood pressure cuff because the cuff is placed around the upper arm and the artery is assessed near the elbow crease. Question 165. To determine our ventricular pulse, the electrocardiogram technician would: Option A, calculate the ST repolarization segments. Option B, calculate the spacing between the P waves. Option C, calculate the spacing between the ventricular repolarization T waves. Option D, calculate the spacing between the QRS complexes. The correct answer is option D, calculate the spacing between the QRS complexes. Explanation. Ventricular rate is determined from the spacing of the QRS complexes because each QRS complex represents ventricular depolarization and normally corresponds to one ventricular beat. Question 166. Regulation of the heart rate, speed of electrical conduction and strength of contraction are influenced by the brain via the nervous system. Option A, autonomic. Option B, somatic. Option C, core. Option D, voluntary. The correct answer is option A, autonomic. Explanation. The autonomic nervous system regulates involuntary cardiac functions such as heart rate, conduction speed, and force of contraction through sympathetic and parasympathetic influences. Question 167. A patient came into the doctor's office with chest pain and shortness of breath. Which position is the best to help him breathe better? Option A, lithotomy. Option B, prone. Option C, Fowler's. Option D, supine. The correct answer is option C, Fowler's. Explanation. Fowler's position raises the head and upper body, which can improve chest expansion and make breathing easier for a patient with shortness of breath. Question 168. The medical assistant is to collect a prothrombin time test, a complete blood count, and a fasting blood sugar. What is the correct order of draw? Option A, gray fasting blood sugar, lavender prothrombin time, red complete blood count. Option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Option C, lavender fasting blood sugar, red complete blood count, green prothrombin time. Option D, gray fasting blood sugar, lavender complete blood count, light blue prothrombin time. The correct answer is option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Explanation. The keyed order places the light blue coagulation tube before the lavender hematology tube and the gray glucose tube, which follows the source's order of draw sequence for these specimens. Question 169. Which of the following specimens are best utilized to measure clotting factors? Option A, serum. Option B, whole blood. Option C, plasma. Option D, sterile blood. The correct answer is option C, plasma. Explanation. Plasma is used for many clotting factor tests because the specimen retains clotting proteins when blood is collected with the correct anticoagulant. Question 170. A patient is having a seizure. Which of the following is the most appropriate step for the medical assistant to take to protect the patient? Option A, raise the patient's feet. Option B, call for help. Option C, loosen clothing around the patient's neck. Option D, administer small amounts of liquid. The correct answer is option C, loosen clothing around the patient's neck. Explanation. Loosening tight clothing around the neck can help protect breathing during a seizure. The patient should also be protected from injury and nothing should be placed in the mouth. Question 171. What is the name of the heart valve that separates the right atrium and right ventricle end? Option A, aortic valve. Option B, tricuspid valve. Option C, pulmonic valve. Option D, mitral valve. The correct answer is option B, tricuspid valve. Explanation. The tricuspid valve lies between the right atrium and right ventricle and prevents backward flow into the atrium during ventricular contraction. Question 172. Before developing a medication schedule, you should evaluate the patient's Option A, bathroom habits. Option B, medical record. Option C, daily routine. Option D, side effects. The correct answer is option C, daily routine. Explanation. A medication schedule is more likely to be followed when it fits the patient's normal daily routine, such as waking, meals, work, and bedtime. Question 173. The information of blood cells is defined as Option A, hematopoiesis. Option B, erythropoietin. Option C, mean corpuscular volume. Option D, hemoglobinopathy. The correct answer is option A, hematopoiesis. Explanation. Hematopoiesis is the process by which blood cells are formed and developed, mainly in the bone marrow after birth. Question 174. The invoice for the monthly rent of the building where the medical office is located is typically handled by which department? Option A, compliance. Option B, human resources. Option C, accounts payable. Option D, accounts receivable. The correct answer is option C, accounts payable. Explanation. Accounts payable handles money the medical office owes to others, such as rent, utilities, and vendor invoices. Question 175. Tachycardia is a pathology that damages mainly the Option A, heart muscle. Option B, brain. Option C, blood vessels. Option D, body organs. The correct answer is option A, heart muscle. Explanation. The source key's heart muscle. Tachycardia means an abnormally fast heart rate and can increase cardiac workload, but the wording that it directly damages one organ should be reviewed for accuracy. Question 176. Hypotension is defined as Option A, no measurable systolic pressure. Option B, systolic pressure above 150 mm of mercury and diastolic pressure above 90 mm of mercury. Option C, systolic pressure of 129 mm of mercury and diastolic pressure of 80 mm of mercury. Option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. The correct answer is option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. Explanation. The source defines hypotension as a systolic pressure below 90 and a diastolic pressure below 60 mm of mercury. Clinical interpretation also depends on symptoms and the patient's baseline. Question 177. When a patient fails to show for their appointment, the event must be: option A, erased from the schedule; option B, written on a no-show log; option C, monetarily charged to the patient; option D, documented in the patient's chart. The correct answer is option D, documented in the patient's chart. Explanation. Documenting a missed appointment creates a clear record that the patient did not attend and supports follow-up, continuity, and risk management. Question 178. What is the minimum number of electrodes that may be attached to the patient for Holter monitoring? Option A, 12 electrodes. Option B, 2 electrodes. Option C, 5 electrodes. Option D, 10 electrodes. The correct answer is option C, 5 electrodes. Explanation. The source specifies 5 electrodes as the minimum for this Holter monitoring setup. The exact lead configuration can vary by device, so equipment instructions should be followed. Question 179. A tympanic temperature means the body temperature is measured. Option A, under the armpit. Option B, under the tongue. Option C, at the eardrum. Option D, in the rectum. The correct answer is option C, at the eardrum. Explanation. Tympanic temperature is measured at the ear canal near the tympanic membrane, also called the eardrum. Question 180. Every prescription for a controlled substance requires the physician's signature and a number? Option A, Food and Drug Administration. Option B, Drug Enforcement Administration. Option C, Environmental Protection Agency. Option D, Centers for Disease Control and Prevention. The correct answer is option B, Drug Enforcement Administration. Explanation. Controlled substance prescriptions require the prescriber's Drug Enforcement Administration registration number because that agency regulates controlled substances in the United States. Question 181. The correct lead from the right arm to the leg is: option A, augmented voltage right arm lead. Option B, augmented voltage foot lead. Option C, lead 3. Option D, lead 2. The correct answer is option D, lead 2. Explanation. Standard limb lead 2 records the electrical potential from the negative right arm electrode toward the positive left leg electrode. Question 182. Which of the following skills would not be an appropriate expectation of the competent medical assistant? Option A, giving instructions to patients about self-care after treatments. Option B, diagnosing common patient symptoms. Option C, performing insurance coding and billing. Option D, using the computer to perform a variety of office functions. The correct answer is option B, diagnosing common patient symptoms. Explanation. Diagnosing symptoms is a provider-level clinical responsibility and is not an appropriate independent duty for a medical assistant. Question 183. The insurance carrier is allowed to use any method to determine the amount for a service, also known as the option A, fee schedule. Option B, deductible. Option C, allowed amount. Option D, insurance premium. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 184. Choose the answer that corresponds with letter B. Option A, brachial artery. Option B, cephalic vein. Option C, ulnar artery. Option D, radial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 185. The correct lead from the center of heart to the positive pole of the leg is: option A, augmented voltage foot lead. Option B, augmented voltage right arm lead. Option C, lead 3. Option D, lead 2. The correct answer is option A, augmented voltage foot lead. Explanation. The augmented voltage foot lead views electrical activity toward the positive electrode on the left leg from a calculated central reference point. Question 186. One example of a physiologic response to negative stress is: option A, headache. Option B, high energy. Option C, sleep deprivation. Option D, upset stomach. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 187. A 67-year-old man is diagnosed with atrial fibrillation and is treated with warfarin Coumadin. What is the characteristic of atrial fibrillation? Option A, sawtooth-shaped waves. Option B, P waves are absent. Option C, P waves with uniform shape. Option D, P waves of multiple shapes. The correct answer is option B, P waves are absent. Explanation. In atrial fibrillation, organized P waves are absent because atrial electrical activity is rapid and chaotic rather than produced by regular sinus node impulses. Question 188. The best way to handle a difficult or bad patient is to: Option A, threaten to report the patient to his or her doctor. Option B, speak firmly to maintain charge of the situation. Option C, help the patient to feel in control of the situation. Option D, leave the room without collecting the specimen. The correct answer is option C, help the patient to feel in control of the situation. Explanation. Helping an upset patient feel some control can reduce confrontation and improve cooperation while the medical assistant maintains clear professional boundaries and safety. Question 189. The tube of choice for glucose testing is: Option A, gray top tube. Option B, red top tube. Option C, light blue top blue. Option D, lavender top tube. The correct answer is option A, gray top tube. Explanation. Gray top tubes contain additives that slow glycolysis, helping preserve glucose concentration in the specimen before laboratory analysis. Question 190. A round, raised skin lesion with itching that is a positive sign of reaction to allergic testing is A. Option A, wheal. Option B, nodule. Option C, papule. Option D, vesicle. The correct answer is option C, papule. Explanation. The source key's papule, but allergy skin testing is commonly described as positive when a wheal develops. This item should be reviewed because the supplied key and standard terminology may not agree. Question 191. Narrowing of the valve between the left atrium and the left ventricle is called: Option A, mitral stenosis. Option B, aortic stenosis. Option C, pulmonary stenosis. Option D, tricuspid stenosis. The correct answer is option A, mitral stenosis. Explanation. Mitral stenosis is narrowing of the mitral valve, which lies between the left atrium and left ventricle. Question 192. Which of the following cannot be handled by the medical assistant? Option A, patient requesting emergency medical advice. Option B, new patient and return appointments. Option C, directions to the facility. Option D, whether or not a physician is in a certain health plan. The correct answer is option A, patient requesting emergency medical advice. Explanation. A request for emergency medical advice requires clinical assessment and decision-making beyond routine administrative handling by a medical assistant and should be escalated according to office protocol. Question 193. The layer of the heart that is responsible for contraction and relaxation is known as the: Option A, pericardium. Option B, myocardium. Option C, endocardium. Option D, epicardium. The correct answer is option B, myocardium. Explanation. The myocardium is the thick muscular middle layer of the heart wall and generates the force needed for cardiac contraction. Question 194. Notifiable infection must be reported to: Option A, the patient's physician. Option B, your supervisor. Option C, World Health Organization. Option D, Center for Disease Control. The correct answer is option D, Center for Disease Control. Explanation. The source key's the Centers for Disease Control and Prevention. In practice, reporting usually follows state or local public health rules, so this item should be checked against the jurisdiction and course standard being taught. Question 195. Coinsurance is calculated based on A. Option A, a capitation rate. Option B, percentage of charge. Option C, a fixed charge for each visit. Option D, number of policyholders in the plan. The correct answer is option B, percentage of charge. Explanation. Coinsurance is the portion of an allowed charge that the insured person pays as a percentage after applicable plan rules are met. Question 196. How far above the site of draw is the tourniquet placed? Option A, 3-4 inches. Option B, 1-2 inches. Option C, 5-7 inches. Option D, 4-6 inches. The correct answer is option A, 3-4 inches. Explanation. Placing the tourniquet about 3 to 4 inches above the intended puncture site helps make the vein more prominent without obstructing access to the site. Question 197. Which of the following procedures is appropriate for preparing blood and other potentially infectious materials for transport? Option A, freezing the materials before transport. Option B, placing the materials in a leak-proof container during collection. Option C, decontaminating the hazardous waste container. Option D, relabelling containers provided for waste. The correct answer is option B, placing the materials in a leak-proof container during collection. Explanation: potentially infectious specimens must be placed in leak-resistant containers so blood or body fluid cannot escape during handling and transport.